Here are my suggestions on how to address selection criteria as a junior doctor in the Australian context. Please remember, this is a key step in getting an interview opportunity. MBBS or equivalent, currently registered or eligible for registration with the Medical Board of Australia. In a paragraph, discuss about your year of completion of MBBS and where have you completed it. Your PGY level, which means in Australia, PGY 1 is an intern. Let's say you have 2 years of junior resident experience, you are a PGY 3 doctor. Also discuss whether you have completed your AMC exams, English exams, and whether you are eligible for AFRA Limited or provisional registration. Demonstrated ability to work independently in a supervised, complex clinical environment. Please remember that you are applying for a job as a junior doctor in the Australian healthcare system. So think from the scope of practice of a junior doctor, which means your ability to take history, do physical examination, do basic investigations, form differential diagnosis, and form a management plan and discuss them with a senior doctor or a supervisor. Also discuss about the type of work, the number of patients you see, your work experience of working as an after-hours doctor, your experience of escalation of a deteriorating patient to a senior medical doctor or a senior surgical doctor. Please explain this with an example with a brief description of a case, the age and the gender, and what you did in that particular clinical scenario. Demonstrated ability to work effectively within the multidisciplinary team. The expectation from this selection criteria is how you appreciate the input from other specialists, nursing staff, allied health staff, including physiotherapist, occupational therapist, social worker, dietetics, and pharmacist. Discuss about the MDT discussions that you've had and the ISBA clinical handovers that you've used. Discuss with a case of a particular clinical scenario where you took the input from the multidisciplinary team to provide comprehensive patient care and to plan a complex discharge planning. Demonstrated excellent communication skills. Discuss about your experience of consults to different specialties, how you use the ISBA clinical handover. If you have aced the English exam, of course, mention the English score report. How you do the patient education based on the patient's medical or surgical conditions, or patient education on the new medications, and which guidelines have you looked through. Your ability to work as an after hours and how you escalate a deteriorating patient to a senior doctor. Discuss your experience of how you can do crisp discharge summaries, including the significant hospital events that happened with the patient, the follow-up instructions to the patient, follow-up instructions to the patient's general practitioner, and how you discuss with the patient's GP using the ISBA clinical handover. Your leadership experience as a doctor at your workplace. Please give an example with a clinical scenario. Pro tip, instead of self-appraising, use sentences from the second person's point of view. For example, instead of saying, I have excellent communication skills, say something like, my colleagues give me feedback saying that my clinical handover is very safe and I always prioritize patient safety. Demonstrated commitment to quality improvement, patient safety, and risk management. Discuss how you have taken quality improvement projects like audits and research. Discuss what initiatives you have taken as a doctor at the hospital and within the community for the patient and staff safety. Give an example of how you do the incident reporting if you have made a mistake. For example, how you do the open disclosure to the patient or to your colleague and how you follow the incident report pathway. Thank you so much.